So welcome everyone. Today is meant to be an opportunity for you to learn more about the Schweitzer Fellowship, and then also to hear from students in the program and for you to get a chance to ask them any questions that you have. We've held a couple of these sessions earlier in this month, and we'll have another one coming up next week as well. And so all of them kind of provide some basic details about the fellowship, and then each we've kind of taken a slightly unique stance. And so today we really want to give them a chance, our fellows, to talk about how they identified community needs. So how can the Schweitzer Fellowship be an experience to help you respond to timely needs in the community? So they'll talk about what their process was like picking a project and a community partner, and then just sharing any general advice as well. So as I guess some initial background, the Schweitzer Fellowship's mission is really about equipping you as a future leader in health and human services to be prepared to identify and address health disparities. You can see sort of the official mission statement there. But what I like to point out to applicants is that it really is about you, although we want to make sure that we're doing right by the community in the process. And so I'm glad you're here to hear about, how do we know that we can respond to needs in the community? Because that's one of the, I think, most, kind of challenging parts of the fellowship is that we have to be really thoughtful from the outset to make sure that we're picking topics that have value, not just to us, but to the people that we're trying to serve. So overall, our program is about improving health. It's also about developing leaders and creating change. And it sounds like everyone kind of watching live today is in a health program, but do you want to point out for anyone who may be in something like, I don't know, psychology or counseling or social work, where, maybe you don't identify with the traditional definition of health? I just want to say that we really follow the World Health Organization's definition and think of that broadly. So complete physical, mental, and social well-being, and not just the absence of disease. So the way that we accomplish this mission, it's kind of a three-prong approach, but the two I think that are most prominent in the program are the mentor direct service project that you do, and then the workshops that we provide. So we've got two fellows joining us today, Sheila and Mayowa, and they'll tell you more about their project and how they arrived at those. But some key factors I just want to be clear from the outset is that although we don't have a prescriptive directive to give you about what your project should be or who you have to work with, there are some minimum standards. And so one of those is that we want the project to be 200 hours that you spend planning and implementing and evaluating it over a whole year. You're obviously doing it in collaboration with a community partner, which means you're not doing it kind of out on your own little island. And so we've got great partners, and part of my role is to kind of help you know who's working in an area that you're interested in, that you may be able to approach about a partnership. And then the educational workshops are the other place where we can build that knowledge and skill base to do the project work. So some of the workshops may be specifically on things like program evaluation. Others are on kind of broader concepts like understanding the social determinants of health and how that impacts these social issues, or how do we engage in communities using cultural humility, as well as how do you kind of engage in self-care so that you buffer against burnout going into these challenging fields. So every year we have an amazing group of projects. This is just a few to kind of show the breadth, I guess, of what can be done. I like to point out that our projects, they take place in settings like schools doing mentorship. They're out in the community addressing, again, that mental social well-being through active things like yoga. They're also supporting caregivers. They're addressing chronic health conditions like diabetes, which is one of the pictures in the bottom right of your screen. HIV/AIDS, we've had students do things that are more about increasing capacity for organizations to take on these challenges. And Josh and Allison's project was a great example of how they were able to kind of put an infrastructure in place through a mobile testing unit to do that. And then the bottom left picture is a senior companionship program that Carson Klein started. So just to say, it's sort of a range of ages, a range of population settings. So, there are many options. And I think that's maybe the other challenging part is narrowing down what you are interested in. But if you want to kind of see, again, more of that breadth, I encourage you to go check out our website. We've got profiles there of all of the current fellows, as well as dating back to 2016. So some of the benefits I think that attract students to apply are just the learning experience. This is an opportunity that you may not have through your coursework. So some people come from fields like public health or social work that have a practicum. Again, it's still very unique to be a Schweitzer Fellow because you are really the one initiating from idea conception, through how am I going to do this, and coming up with all the steps that are going to be involved. So it's a little more self-directed than most internship and practicums would be as well. But for those who are in a field where maybe your first few years is very heavy coursework, this can be a welcome opportunity to sort of get outside of the books and do something. There is a small stipend, although I think no one does this experience for the money because it's not a lot, but we do provide $2,500 over the course of your year. And then I think our connection to people around the country, we're one of 13 sites. So Alabama is just one of many places that every year picks a number of fellows. And so at this point, our alumni total around 4,000. So with that, I want to turn it over and give bulk of the time to our two guest presenters. I'll let Mayowa start. Like I said, I've invited them just to briefly share about their projects and then specifically to kind of explain how they gathered information in order to even identify what topic they should pursue. Mayowa, feel free to, I tell you what, I'm going to stop sharing my screen just so we can see your face a little better.
Okay. Hi, everyone. My name is Mayowa Otuada, and I'm a student at the UAB School of Nursing graduate school. I'm currently doing my Doctor of Nursing practice, and I also work as a nurse at UAB Women and Infants Center. So for my Schweitzer Fellowship project, what I did first was I went online and I tried to identify some of the health issues in the state of Alabama. And so depression was one of the things that I found that was most prevalent in the state. And so like I said, I work at the Women and Infant Center, and I also have, a little experience working with women. I'm originally from Nigeria, so I have some experience working with women also. So, and my passion is about improving women's health. So that kind of tilted my project towards, just improving women's health. So what I did was, since I found that depression, is just really high in the States, the prevalence is really high. So I just talked to my professor. She is the director of Nurse Family Partnership, and Nurse Family Partnership is an organization that work with pregnant mothers from about 20 weeks until the baby turns age 2. So what they do is they do home visits, they check on the mom and make sure that the pregnancy go well. And, they just watch the baby and the mom until age 2. And so when I talked to her about my interest, about depression, and so she talked to me, she was like, oh, why don't you do something like postpartum depression? because she told me that's one of the things that is very common among their clients. And so, and really, these are first-time mothers. You know how challenging it is, you know, being pregnant for the first time, and then most of them are single mothers. So postpartum depression is highly prevalent among this patient population. So that was how I got to identify my project. So I talked to her. She was like, yeah, that's fine. You know, you can partner with us and then we can help you with your project. So, you know, she gave me the go ahead and like, just let me know everything that you need. And so that was how I started my project. So initially, my project was supposed to be an in-person support group. So what I did was, so with COVID, I couldn't do an in-person postpartum, you know, support group for women with depression. And so I had to like adjust things a little. And I also read a lot of articles online, you know, that talked about postpartum depression, that about 1 to 7 moms have postpartum depression or anxiety. So that I just did a bunch of things, you know, to like kind of like help me, you know, make up my mind that, okay, this is what I'm going to do for my Schweitzer Fellowship. And so, like I said, I talked to the director of Nurse Family Partnership, and she just gave me the go ahead. And so after I identified, I just made up my mind that I was just going to do an in-person support group for these mothers. And my aim was that we were going to talk about, you know, how to address postpartum depression, you know, how to empower these women, because most of them are just like single mothers, like I said earlier, and, you know, coping skills, mechanism, and all of that. Nutrition, how to care for your baby, to care for yourself, you know, and just go through everything that life throws at you, kind of thing. So, but we couldn't do the in-person because of COVID. So I had to like just change a little and just turned it into an online support group. So I created a Facebook page for Nurse Family Partnership clients, and I designed a flyer, did a bunch of things. So I shared all this information with the nurses, and they just sent it out to their clients like, hey, if you're interested, you know, in this program, you know, you can join and all of that. And right now in my group, we have about 56 clients. I have about 56 clients in the group. And, you know, it's been amazing. The things that we talk about, the things that I share with them. And, you know, a lot of them come out to say, oh, this was what I experienced when I was pregnant. Oh, this is what I'm currently experiencing and all of that. So it's really motivating, and I'm very proud of my project.
Thank you. Yeah, I think that's a great example of how you really looked at the data and realized that Alabama was at the forefront of postpartum depression, which is not what we want to be at the forefront for. So, Sheila, I'll let you speak, and then maybe we'll let y'all go back and each say any advice that you have for the applicants.
Yeah, so hi everyone, my name is Sheila. I am a second-year med student at UAB School of Medicine. And I'll start off by saying one of the main reasons I wanted to get involved with Schweitzer is because I know for a lot of like different professional schools, and I think especially for the School of Medicine, you spend your first 2 years like just in the books, and there's not a whole lot of hands-on experience that you can do, especially given what's happening right now with us, you know, our hospital access being a little restricted. So Schweitzer is a great way to get some hands-on experience with whatever your field is, because it just gets you in the real world, working, getting a feel for what's actually out there. So I think that's honestly one of like the things I'm most excited about this, because it gives you a little perspective outside of, you know, burying your head in the books. But outside of that, so being a med student, I knew I wanted to do something with UAB Hospital just because it's so relevant, and a lot of it would be connected to, you know, what I'm studying on a daily basis. But as a first year med student, like 2 months into school, I didn't really know anything about what I wanted to do. I still don't know particularly what I want to do, but I think I was especially a little more lost then. So what I did was I found like a few of the bigger departments at UAB Hospital and emailed their like research coordinators to see if any of them had space to take on another person and what projects they were specifically looking for. So one of the people that got back to me quickly and seemed really interested was the representative from Spain Rehab, which is a rehab facility connected to UAB. And I think my experience is a really good story about how you can go from like a 0 to 100 real quick, especially when you don't know what you're doing at the very beginning. So she was one of the ones that got back to me. So when I was speaking to her about Spain Rehab, she was a research coordinator for all of Spain Rehab. And the rehab center worked with a lot of different specialties because there's a lot of different specialties in medicine who need rehab. For example, you could be working with ortho people or neurological patients or people who have muscle problems or patients who are there for old age, like truly just the whole spectrum you get that come through the gamut, which was really helpful for me because then I could figure out, like what I exactly wanted to do. But more than what I wanted to do, it was a factor of where they needed help. So the research coordinator knew that there was the neurology section of the hospital was looking for more help with general projects that they were doing. So then, my focus kind of distilled further from there because, I can want to help all I want, but there's no point in me helping someone who doesn't need the help. So then I was put in touch with the pediatric neurology services. Then there was one physician in particular who was running a adult spina bifida clinic who was actually working with transitioning younger spina bifida patients into an adult spina bifida clinic, because primarily, 20, 30 years before, patients who came in with spina bifida had these severe neurological complications, and with the treatments back then often didn't even live to see adulthood. However, now with all the progression that's happening with treatments and supportive care, we're seeing more and more patients progress not only into adulthood, but much further than that. And that's happened over a relatively short period of time. So there's been a kind of a catch up that healthcare facilities have had to do to transition from pediatric care to a more adult focused care. And that's one thing that UAB is focusing on right now, opening up an adult spina bifida clinic that specifically is focused to transition patients from the pediatric care into more of like a general practice care management. And it's really, really cool because it's one of the only ones down here in the South. And it's in such a cool environment to be part of because you are seeing physicians from every discipline come into this one clinic. Because obviously with all their limitations, it's very difficult for spina bifida patients to travel and come to the clinic. And there's just so many logistical issues that come into it. So when they're here, for their usually yearly visit, you want to be able to get everyone that they need to be seen at once, whether that be neurology, PT, OT, urology. You just want everyone one day visit to be done. And that's so cool. So you're in the clinic and you see cardiologists coming in, you're seeing urologists coming in, you're seeing social workers come in, you're seeing so many people from so many different disciplines come in. So it's a really, really cool multidisciplinary environment to be part of. But then once I got there, I knew that that clinic overall needed help, but I didn't know, what exactly they needed help with. So then I was put in touch with the physician who runs the clinic overall. So I was able to sit down with her as well as some of the nurses who handle the day-to-day duties of the clinic as well to figure out where their needs were. And then, when we got to talking, we found out that specifically with the gastroenterologists and the urologists that some of these spina bifida patients are being seen, they are having trouble creating a standardized protocol for bowel management. So, for us, when we go use the bathroom, it takes us like 5 minutes max, and that's probably if we're like playing on our phones too when we're there. However, for spina bifida patients, there's just so much planning and, again, more logistical issues that have to go into the simple task of using the bathroom. And so we're trying to create a standardized protocol to not only get through this process, but also kind of help troubleshoot, some common problems that some of these patients might be seeing. because again, they're only coming into clinic and seeing their physicians once a year. And there's so much that can happen between a year-to-year basis, especially if you're not having a very frequent follow-up care in between these visits. So kind of directing patients and having them be able to follow a certain protocol, if X goes wrong, follow Y, if Z goes wrong, follow A, may make it a little bit easier to triage and kind of decrease the complications that are being seen by the time their next yearly visit comes around and these problems have already gotten so much worse. So that's a little bit about my journey. Again, didn't really know where I started, but loved where I ended up. So it's going really well.
So while you're on, Sheila, do you have any general advice for applicants?
Yeah, I would say just, I guess 2 things. One, keep an open mind because you really never know where you're going to end up. And I think that's been a pretty common theme for our Schweitzer class, especially, having COVID hit halfway in the middle. You really don't know what you're doing. And at times you just have to, again, coming to my point number 2, be able to roll with the punches and adapt to whatever the situation may be. And I know I think I truly got lucky because my project is mainly going to involve a lot of phone call follow-ups, but so many people who are relying on, in-person support groups or things to do with schools or really anything in person, a lot of their programs got disrupted significantly. And, you can't just stop and give up. You have to find ways to keep going forward. So I think keeping an open mind and being able to go with the flow is a little bit important.
Well, and that reminds me, I was actually having a phone call yesterday. So for all the applicants listening, we are trying to do some just really brief interviews with some community partners at agencies like the health department who are seeing kind of a big picture view of what's happening and how it's shifting the landscape of needs right now. We're going to release a video to you all around mid-November with that information. But in that conversation, she, really just complimented the fellows on being so adaptable this year. So I think what you said, Sheila, is a good point. Mayo, would you like to add anything to that about general advice for applicants?
I would just say that try to identify the needs in the community. Like once you identify the needs, reach out to organizations and ask them, what they do, what kind of people do they see, what kind of problems do they see that they've identified among their clients, things like that. And like Sheila said, just be open-minded and, be ready for anything, whatever you get, just do it. Because sometimes what you're passionate about might not be, what you'll end up with. So just be very open-minded and, just be ready for anything, really.
Well, I'm sure there are other questions for y'all before we kind of open up the floor. Let me say a few things about kind of eligibility because that might also be on people's mind. So we are, kind of aiming for the February 1st deadline of applications, which means fellows or applicants who apply now would be a fellow from March 2021 until April 2022. So just want to make sure everyone who's applying will still be enrolled in graduate or professional school in that time period. There is a mandatory orientation which will take place on Saturday, May 1st. And, beyond that, we have the monthly meetings that I mentioned, but we account for people, having some absences over that time frame. There's a lot more information and FAQs on our website. And then the application itself is also online. So I just want to reemphasize that the application, so when Sheila and Mayowa applied, and then when you all will apply, we have changed it from kind of the traditional application. And the biggest difference is that rather than having to hone in and apply with a project, with an identified partner, with your mentors already picked, we want to help and mentor you through that process. So we're asking you this year to tell us kind of what your interests are and your goals overall. And then we'll give you a little bit more guidance in March and April of your fellowship year to finish that process. So some of what, well, really, I think most of what Mayowa and Sheila described is, interviewing, asking questions of their sites, doing some of the searching for data, using online resources. That really took place in their first few months of the fellowship as well. So we want you to do a little bit and be aware, but not feel like you have to have all of the answers up front. So that's one, I would say, difference. Otherwise, though, I think I just want to make sure I get contact information from you and then I can stay in touch. Like I said, there's going to be things like that video premiere that we're going to put out in mid-November. I want to make sure I can send you details so that you can tune in or watch it afterwards. So if you can drop your contact information to me at this link, bit.ly ASFA, which is capitalized, and then interest. That way I can stay in touch. And I'll put this in chat for those who are listening. But in our last few minutes together, just want to see if you all had any other questions that we didn't answer yet.
I had like 2 questions. My first question was like, do fellows typically are they typically fellows for multiple years, or is it normally like a 1-year thing? And then my second question was, for the 200-hour requirement for the project, do people normally, are those hours, do those go into like the planning processes? Like, are those hours considered part of the 200? And like, is it like normal for people to do like one like catalytic, like big event, or are they mostly like over time, like following up? Does that make sense?
Yeah, those are great questions. So, so you asked a question about hours. The 200 does include planning. We want to make sure we're emphasizing the kind of like execution of the project and not spending all of our time planning. So the kind of Schweitzer guiding principle across the country has usually been that of the 200 hours, at least 100 needed to be in direct service, which meant that you could use the other up to 100 hours doing all that work that goes into researching your issue and, et cetera. One thing I will say is that with COVID, we've just tried to be more flexible on our end and what we meant by direct service, because there's just kind of a blurrier line sometimes, like when Sheila's, attending meetings with the faculty or researchers or whatever, like we certainly consider that direct service, even if it's taking place through like a Zoom meeting or anyway. So this year we've just been, I would say, more flexible, but we still want to kind of make sure that we're not doing a research project, essentially, that it's not just all theoretical and not about delivering an actual service. Your question about kind of the timeline, yes, so this takes place within that 1-year time frame, so March 2021 until April 2022. And, projects sometimes I don't want to say don't wrap up by then, but what I mean is sometimes we might have one goal for what's going to happen by April 2022, and then we realize oh, that was too ambitious. And so, the fellow just has to adjust their goals to make sure that they finish within a year. Now, we have had some students who are like, I'm so passionate about this, I want to keep going. And if you want to keep volunteering with your agency or somehow support it to live on, you're welcome to do so, but that's not the expectation of us at the fellowship. So our expectation is that by the end of April next, 2022, you'd be able to hand it off. So we talk a lot about sustainability because we also don't want to create something great and then drop it and leave the organization. So it just takes being a little bit more thoughtful. Sheila's project, there's obviously going to be like a protocol to kind of hand off, but it may take some preparation thinking about, well, who on the care team needs to receive these protocols? What other kind of patient education materials do I need to make sure are prepared in order for them to give this advice consistently to future patients? Mayowa might need, she's planning to kind of identify someone else in the group that can serve as a co-facilitator in the spring, so that when she leaves, they then become the main facilitator. So there are ways that we can try to get longevity out of the projects without you having to be the one continuing that work. And then what was your third question, Nolan?
I think you answered it all. Thank you.
Okay.
I have a question. Do students typically do projects with already established community partners, or do they forge their own partnerships sometimes?
Yeah, another great question. So there needs to be some existing entity, but it's looked pretty different. So Sheila's obviously with like a very large established group. Mayowa's with another one who has like a statewide record and using an evidence-based model, you know. And then we've had people who are with organizations that are run by, you know, a single person, or even with like neighborhood associations. So it doesn't have to be kind of a, you know, nonprofit per se. But I do think it helps to have some kind of stability where whoever you're partnering with, but you could certainly help them expand. So we've had a lot of students who, and I know you're from the School of Medicine, so I'll go back to Carson Klein as an example. Part of what Carson did was create the Senior Companionship Program. Another former fellow from medicine had created like an Academy of Health Science mentoring program. So sometimes in the course of their project, it is creating at least like a student interest group that will be involved in the project year, and then that can even like continue it once they're done. But I'd be happy to talk to you. It sounds like you have something in mind, and so we could talk through the specifics a little bit more.
Thank you.
Yeah.
How have those been able to manage time with the fellowship versus with demanding or rigorous coursework at medical school, dental school, whatever it might be?
I'm going to let Sheila and Mayowa answer that.
Yeah, I think it's not easy, but I think it's just a matter of planning. So I think I just would look at my schedule, you know, a couple weeks in advance and plan out like when I would need to go in clinic, like what would be the best days, and just having it all, you know, worked out in advance. Because at least in my case, like it's not just me that, you know, I have to take my schedule into account for. It's like, you know, if the physician's going to be there, if the nurses are going to be there, you know, what patients are being seen. So like just planning out my schedule, maybe like 2 weeks in advance, like, and that also gives time for physicians or nurses or whoever to respond to all my emails and, you know, schedule a time that works for everyone, I think was super, super helpful, but it's definitely manageable. It's not bad.
Yes, I agree with Sheila. It's very doable. I'm also a very busy person. I'm a mother, I'm a student, I'm a wife, I'm everything. I have a full-time job, you know, in school. So I think anyone can do it, really. You just have to plan ahead and just know that, you know, you just have to manage your time really well. Yeah, that's it. Just plan ahead. Whatever you are going to do, just, you know, plan ahead like 3 or 4 weeks ahead. This is what I'm going to do. This is the deadline and everything. And it's working for me.
And one thing I will follow up on just to kind of help quantify and break down like what 200 hours might look like for students who choose to spread it out over the year. That's, you know, 4 to 5 hours a week. We have had projects, and again, depending on your discipline, you may say, well, we've got like a summer break, or I'm going to have a lighter spring term, or, you know, whatever the case may be. And so sometimes students will plan projects that are going to have kind of an increased involvement at one point in the year and then a decrease at another. And I would say that's important for you to consider when you're thinking about who your partner may be, because you may say, well, I really want to kind of, do a lot, like put a lot more energy in the summer when I have these 3 weeks or 6 weeks or whatever the case may be off. Well, then you're not going to partner with the school, right? Because the schools aren't going to be in session then. Now you might be able to partner with like a Boys and Girls Club that has like a summer camp option, so you can still connect with school age children, but we just have to be really thoughtful about kind of, what that pattern of involvement is going to look like. And even if someone had, for instance, like a big summer project, Nolan, I think you asked about, that was the other question I didn't answer, but it was like if people do sort of like a one-time thing. So let's say you're helping an organization like the School of Dentistry organize their CARES Day, where they're doing a big, get a lot of people to come and get dental work done. There's still going to need to be stuff, obviously a lot of work leading up to, but then afterwards, I would say, you're probably going to need to have some involvement, and maybe it's, well, let's do a better job of making sure that all those clients we saw have some follow-up source of care. If they got, I don't know, maybe they just need placement with kind of a more regular provider. So anyway, so I think there are some ways to, yes, where maybe there is a big event that happens, but more likely your Schweitzer Fellowship projects are going to extend over a whole year more consistently. Any other questions? One thing I want to say before you leave is that we have been recording the prior sessions as well. And so I just want to point out that if you go to our YouTube channel, you can check those out. If you're watching this one, then the beginning 10 minutes where I'm talking may be boring and you might want to skip through that, but definitely, use those as another opportunity to hear directly from other fellows. We have kind of had focuses on like, how can you leverage your research interest and goals to make an impact in the community? That one was really, I think, geared especially towards PhD students, but might be applicable for others. We've talked about how fellows have been able to build from their experiences. So really thinking about like, what have you personally encountered in your school or in your personal life that might inform a project or partner you'd want to build from? We talked this past Sunday about career goals and how, again, that sort of has shaped people's choice of a project, but also how the project has impacted their career goals. And then next week, we'll do like a general FAQ. And so there will be even more fellows and fellows for life talking. So those are just a good resource. And speaking of YouTube, we are on various social media platforms. So if you are on any of these as well, we'd love for you to follow us so that you can, again, just see various things, not only about recruitment, but just what fellows are doing overall throughout the year. I'm happy to stay on and answer any questions. I'm going to stop the recording here and just want to, again, thank you for joining us today.